Good morning and happy Mother's Day. We begin our program this morning talking with the Commissioner of the Connecticut Department of Public Health, Dr. Manisha Juthani. Commissioner, thank you for being with us.
Thanks so much for having me.
I said we've had you on the show a million times. This is the first time we've ever sat together. We've always done it on the Zoom, so welcome to the studio.
Great to be here.
So let's start with the bird flu. There's been a lot of talk about it. I know there's very limited human testing and even more limited human results, but are you worried about it?
Bird flu is something that we've been worrying about for a very long time and actually been preparing for a very long time. Whether it be at the state level, at the federal level, there have been plans in place for decades, actually. But now we actually have seen over the last couple of years that this has moved from the bird population more recently now to the cow population. And the one case, human case, that has been recent was in a farm worker who had direct contact with the milk from an infected cow and caused pink eye, essentially, conjunctivitis. And the person got better very quickly. It was a very mild case. But having said that, we know that so many of these types of viruses originate in the animal population, can make their way to the human population. So we have to be very alert about this and have been doing just that. My risk assessment for people in Connecticut is very low at this point. We don't have any herd populations that are positive. We don't have any cow herd populations in the Northeast that are positive to date. But that does not mean that we aren't planning and preparing for something that could come.
And we saw, obviously, the concern when you hear about the cow population, you start thinking milk. And we heard early on reports that, oh, well, everything's, pasteurized and ultra pasteurized and don't worry, it's fine. Then there was some testing that said we might have a little bit of it in some of the commercial milk supply. Is that something people here should be worried about? Even if the cows here aren't positive, could milk be coming in?
What we have found so far is that testing of pasteurized milk has shown that there's fragments of the virus that may be in milk. That's actually not as concerning to me in the sense that if there was a live virus there, it was killed by the pasteurization process. So the good news is that pasteurization works. It's worked for hundreds of years, and I believe that pasteurized milk is safe to drink because what we've seen is fragments does not mean active live virus that can actually infect somebody. However, when we're talking about raw milk, what we know, for example, even the human case that I described was a person who had contact with an infected cow, and milk in infected cows is the most infected byproduct from the cow. And so raw milk, I still have concerns. I know that raw milk is appropriate to sell in Connecticut, and there are regulations in place through our Department of Agriculture. Nevertheless, pasteurization is the safest way to make sure that you're actually getting a safe milk product. So pasteurized milk is something that I think we can still rely on.
All right, that's some news you can use right there. Let's talk, we led into this saying we had been through one pandemic. Let's go back to that pandemic because we're still talking COVID. There's this new flirt variant. Tell us about that, and is it concerning to you?
What we've seen since the initial introduction of the Omicron variant is that there have been a number of subvariants of Omicron that people have been seeing. Flirt is no different. It's yet another subvariant of the Omicron virus. However, what does concern me is that many people have not gotten the updated vaccine on a yearly basis for these last few years. There are many people who I know who said that they got their first booster and then that was it. And it's been a few years since they've gotten something. And so what I would just be concerned about and just want to make people aware of is that the new variants that are emerging now, the CDC is looking at those variants now to determine what is going to be in the fall vaccine. And most likely that will inform what is going to be in the fall vaccine. So I will start now saying when the new vaccine comes out, I would get updated because that's really the best way to prevent yourself from getting a more severe case of COVID or getting in the hospital, potentially having more dire consequences, or potentially even getting long COVID. So these are all the things that people have known about. But I think what we also have seen for the last couple of years is that we have had a late summer wave that has happened. And so what we don't know, and unfortunately I can't predict, but I can say, looking historically, I won't be surprised if in August we see a wave again. Maybe even by the end of July, we start seeing cases go up. So if you haven't gotten that booster, you may be a little bit more vulnerable for a case of COVID coming up this summer.
I do want to get to other topics, but on the COVID thought, Jay Wieland, who is a data scientist who a lot of people follow, I know the School of Public Health dean at Yale said, I'm watching what he's saying. And he's saying that there could be a summer surge. So is that something, like you said, you can't predict, but he is someone who predicts, so maybe we need to watch for it?
I fully would be prepared for that. We've seen that now for several summers. I mean, this is going back to 2021, we had a summer wave, and every summer since then we have. So it will not be surprising at all. Unfortunately, COVID is not quite acting like flu or other respiratory viruses where it really goes away for many months. We see very low levels right now. It's certainly minimal transmission, but unfortunately, I will not be surprised at all if we see a summer surge.
We've got 2 minutes left, and I got a couple more topics. I want to talk to you about mosquitoes and ticks. The warm, wet winters have been a problem for both those. What are you urging people to do on both those counts? Because both you have to be concerned about.
There's no doubt that because we have not had hard frosts in the same way that maybe the winters that we remember might have been like, the ticks, mosquitoes, they're acting up quickly. We know that we've had tick-borne diseases, mosquito-borne diseases every summer. And what people can do, it's a little bit of the same old that they know about. But, if you're going to be walking in the woods, trying to keep your skin protected, whether that's wearing long socks, making sure that maybe your pants are tucked into your socks. You really want to try to limit skin exposure, particularly in dawn and dusk, the times when mosquitoes are out. So those are the main things you can do to try to protect yourself. And don't forget the pets, because the dogs, if they're out there, you want to brush them down. And because sometimes people sleep with their dogs, they have their animals close, you want to think about kids, you want to think about older people to keep people safe.
Well, and more of a year-round issue as well, maybe something just to keep in mind.
Absolutely.
And I want to just ask you, we saw those wildfires last year up in Canada. Mark Dixon was on the show, our chief meteorologist, a couple weeks ago, and he was saying that's one big thing he'll be watching from a weather perspective. But obviously air quality affects public health. Will you be watching that as well this summer? Absolutely.
We know last summer air quality, asthma presentations to the emergency department went up with those wildfires. We have to be alert for that. We know that our first heat index alert went out in the beginning of June last year. And we've got a long summer ahead of us. People need to be thinking about, again, vulnerable populations, but everybody can stay cool, can stay inside, try to protect themselves from direct sun exposure, try to be aware of what that air quality index. People got a little bit more alert to that on their weather app to be able to see, well, if I have breathing problems, is this a good day to maybe stay inside and not go outside? Those are the kinds of things people can do to keep themselves safe.
Pasteurized milk, get a booster shot, check for ticks and mosquitoes, and keep an eye on that air quality alert.
Great summary, and I would just say that if you have bad air quality and you need to be outside, don't forget you can use a mask to help protect yourself from some of those even environmental contaminants. We think of in COVID wearing a mask inside, but sometimes people in California do it all the time when they wear it outside.
All right, Dr. Manisha Juthani, thank you for being with us and being here in studio. We'll have you back again soon.
Great to be here. Thank you.